Big data is up and coming within the healthcare field today. What is big data, you may ask? Big data is a massive volume of both structured and unstructured data that is so large it is difficult to process using traditional database and software. Therefore, people need to find ways to store all this data in a professional and diligent way in order to benefit everybody else. Big data has the power to help companies improve their operations and make fast, intelligent decisions when used correctly. The healthcare field has recently started getting used to big data. They use big data now almost daily to store all patients' information. Through softwares such as electronic health records, it makes it easier for providers to keep up with their patients. The Center of Disease and Control reported that on average, there are 928 million visits to the doctor's office per year. Now you see why the healthcare field needs to implement big data into their practices. With all these visitations, there needs to be some way to store every individual's health records. As mentioned before, electronic health records propose a diligent way of using big data in healthcare. They are the electronic version of a patient's medical history. They're maintained over a period of time. It includes clinical data relevant to the patient, such as a demographic, progress notes, problems, medications, vital signs, past medical visits, and more data. Electronic health records are a good example of how big data is being managed in the healthcare field today. Although unfortunately, not every hospital in the US is using big data. In fact, only 50% of the hospitals in the US are using big data through electronic health records. A good example of electronic health records being used for big data purposes is mentioned in a presentation that Dr. Kabler makes at Chottington. This hospital does use the charts effectively, and positive outcomes are reached.
So groundbreaking research. So can big data in healthcare be used to easily research isolated clinical observations? So this is the one that was alluded to in my introduction about pediatric hypertension. So I'll tell a little bit more of the story. So I used to be the medical director of a pediatric weight management program at Metro Health. These are 3 of the children that I saw. I'm using their pictures with permission. And so what would be happening is they would be referred to me because they had a weight problem. And what I would see a couple times a week is on my comprehensive evaluation, the first time I saw them, not only would I see that they had a weight problem, but I would also discover that they had a blood pressure problem. And what would happen is, I would have these conversations once or twice a week where, generally the parent, because these were younger children, the parent was very shocked by this. They would say, my gosh, I didn't even realize that children could have high blood pressure. And the other thing is, why are you the first doctor that's telling me this? Because I've seen other doctors in the healthcare system. In fact, I was referred by one of the doctors in the healthcare system. But yet, you're the first person that's telling me this. And what a lot of times I have to say is, your child has had high blood pressure even for a couple of years. And what I recognized was there's an information processing problem where the data was in the electronic health record to make the diagnosis of hypertension, but the other doctors weren't seeing the data because it was harder to translate a blood pressure number in kids to recognizing if they have a blood pressure problem. And so there's sort of 2 things that happened to me. One, I said, well, I'm seeing a couple patients like this a week. Is it just these couple patients, or is actually this the tip of the iceberg where this is really a huge problem in children? The other thing I thought about was, hey, probably we could get the electronic health record to really help make the diagnosis, to help identify these abnormal blood pressures, because it seemed like, physicians were missing this. So it then stimulated me to do my first query in big data. So at that time, big data for me, I was able to identify over 14,000 patients that had been seen in our healthcare system enough times to figure out if they had pediatric high blood pressure or not. And this is really sort of the summary slide here. So of the 14,000 patients, basically about 500 met criteria to have hypertension, but only about a quarter, only 26% had ever been diagnosed. The other 3/4 had not been diagnosed. So if you take this to the national level, what this means is that there's about 2 million children in the country, somewhere around 3%, that probably have high blood pressure, and only about 500,000 have ever been diagnosed. There's about 1.5 million children, in the United States that have high blood pressure that has probably not been diagnosed. This was published in the Journal of the American Medical Association, as was mentioned. It got a lot of press at the time from the American Heart Association. I don't know if there's any Ladies' Home Journal readers in the audience. It was highlighted there as well. But one of the things I liked the best was after I gave this presentation, one of the pediatricians from Children's Hospital of Philadelphia came up to me and said, "It's like you discovered a Post-it note." And what he meant by this, it's interesting being a researcher. A lot of times, I got to get my elevator speech down to about 15 seconds because I feel like if it takes more time than that, it's hard to keep the attention of the audience. But what's fascinating about this topic is anytime I talk to somebody that takes care of children, by the time I'm like at 14, 15, 16 seconds, I can see the light bulb go on in their head, and they're thinking, oh my God, I am not doing this in my population. How many of the children that I'm seeing have high blood pressure, but I haven't figured it out? So one of the challenges when I'm talking to research or others is say, this is probably one of thousands of Post-it notes that live in electronic health record big data. So we just need people, we need the data, and then we need people to start looking at the data to find all the other Post-it notes that are there. And again, these are not, they're pretty obvious findings once you get them, but the key is that because nobody's had access to this big data before, nobody's looked, nobody's been able to figure out these things that in retrospect seem relatively obvious if you're sort of in the field.
This case study was just one of many case studies that Dr. Kabler conducted, where electronic health records and implementation of big data helped everybody widely. Through efficient use of electronic health records, hospitals and clinics will be able to tackle the concept of big data. Not only are electronic health records addressing this big data explosion, but the use of evidence-based medicine has been seen to make a big breakthrough as well. Evidence-based medicine involves systematic review of clinical data and making treatment decisions based on the best available information given. Using individual datasets into big data algorithms often provides intelligent and clear evidence. If you think about it, evidence-based medicine has actually been used for years, although the words themselves have just been coined recently. Physicians have been treating their patients based on evidence from multiple other individuals who have the same symptoms or diseases. These practices have been done since the 1980s. The implementation of electronic health records in evidence-based medicine can benefit hospitals and clinics when used correctly. Dr. Paul Brecher, CEO of Optum Labs, discusses how big data, if used effectively, can benefit individuals' overall health, as well as lower the healthcare costs, which is much needed with how healthcare is within the United States.
Sure. So the concept a couple of years ago was that Mayo Clinic and Optum saw the opportunity to take data from that Optum and Mayo Clinic had collected, both claims data and electronic health record data, and bring that data together in a completely de-identified and private fashion, but to make it available to researchers and innovators and what are called clinical translators, people who want to take results and bring them into the clinic, to improve healthcare and to reduce the cost of the delivery of that improved healthcare, to make that data available in controlled fashion so that collaborations could form. And we were given the asset, Optum Labs was formed, and we were given the asset of this data, and we were invited to basically create collaborations. And we now have about 20 partners who've come in and joined Optum Labs who are participating in, we now have something like 50 active projects that are going, that are all oriented towards many different diseases, many different areas of improvement of healthcare, but all working together towards a common goal.
Well, and the cool thing about this is that medical claims, when the average person watching this thinks of a medical claim, they're thinking, that's something I got to pay. But when they think about what's in that,
Right.
I mean, walk us through perhaps an example of how this is used and maybe one of the partnerships, and tell us maybe what they might be looking for.
Sure. So medical claims have a lot of information in them. They have the disease, they have information about where the medical procedure or medical examination was performed, and they have a lot of other detail. We can link that, again, in a de-identified fashion with a bunch of demographics, with lab results, with medications, and we can begin to look at how the medical care was delivered. We can identify somebody who has their first episode of, let's say, hypertension, and you can see that for 2 years before, no doctor has said they have hypertension, and so you know this is their first episode, and then we can see whether they're prescribed a drug and whether, using the electronic health record and using the claims data, whether they fill that prescription. So if someone who has hypertension isn't on a proper drug for hypertension, we can begin to determine whether it was the physician's behavior or the patient's behavior that caused that. And when you look at that in large populations, you can make correlations to understand whether there are health-related, demographic-related, or any of an enormous number of different things that could explain it. I can give you an example of an interesting project that actually has been done with Optum Labs, one of the earliest ones. It's already been published. And that is the treatment of diabetes. The first drug for which someone is treated for diabetes with is established by guidelines. The second drug, if you don't do well on that first drug, really is a choice for clinicians between several different drugs. And some of those drugs are older generic drugs, and those are less expensive. And some of those drugs are newer, more expensive, and newer classes of drugs, as they're called. So someone did, one of our collaborators did a study with Mayo Clinic using the Optum Labs data, and they determined that in all three of those drugs, the old generics as well as the newer classes of drugs, for similar amounts of diabetes control, there was very similar outcomes in terms of quality adjusted, what are called quality adjusted life years and life years. That is how long you lived and how well you lived, if you will. But there was an obvious, for a given quality adjusted life year, for a given year that you live at a certain quality, it was much less expensive to do so with a generic drug. So now you have real evidence that you can go to a hospital formulary with and say the outcomes are essentially similar, but the cost is dramatically different. And so here's an opportunity to intervene and lower the cost of healthcare.
Yeah, and that's interesting because historically, for someone who's written about healthcare for as long as I have, a drug company would come out and say, well, it's a pill, and when we get people on the pill, that's cheaper than a surgery, whatever, but they never really looked at it. Nobody ever really said and looked at the data. So now what you're saying is you can look through, if I am in this database because I have a certain medical claims history, and you look at people like me and the medications that I'm on, you can do more of a cost, benefit, and quality analysis than
well, in clinical trials, when clinical trials are done to get a drug approved, the purpose of a clinical trial is to show the efficacy of a drug. Is the drug effective compared to placebo or compared to another drug? Sometimes some of those cost effectiveness things are looked at, but the true effectiveness of a drug can only be determined by examining populations of patients who are treated with the drug. And that
find out
has
whether
to be
it's
done,
needed.
Right, that has to be done with observational data, and you can draw out a lot of information. Sometimes it's difficult to determine causality using that A caused B, but on the other hand, it gives you an opportunity to look and do different examinations and even go back and do a clinical trial to demonstrate something that you think is an important trend and could bring a lot of value, for example.
As Dr. Beecher mentioned, big data can only benefit the healthcare field if it's used effectively. In order to effectively use big data in the healthcare field, the 5 V's of big data need to be mastered. volume, velocity, variety, veracity, and value. Volume means the amount of data collected and stored within the healthcare field. Velocity, the speed at which the data is generated and accessed. The velocity needs to be fast in order to work within the healthcare field, so physicians and nurses have immediate access to the information. Variety, wide array of data sources and formats that benefit clinical decisions. Veracity, the variability of structure and applicability. Value, how physicians can get the most out of their data to improve patient outcomes. Mastering the 5 V's will lead the healthcare field to mastering big data itself, which will further benefit every patient in the healthcare system as a whole. The use of big data in healthcare needs to be reviewed and seen as a positive factor. Once healthcare starts to use the big data and further uses big data, they will benefit widely.